So we are live. Good afternoon, ladies and gentlemen. My name is Syed Moazzam and I work as Head of Marketing and Admissions at the International School of Choueifat, Lahore. The International School of Choueifat, Lahore is member of SABIS Network. SABIS Network has an active presence in 20 countries and 5 continents. I would like to thank the speakers and the audience for joining us today in this very important program and a series of programs that is called Experts Talk to ISC Lahore. Today, I would like to mention that today is the 15th program of this series, and the topic that we'll be discussing today is breast cancer, a myth buster discussion. The purpose of this program is to create positive and right attitude to address this issue. With this program and discussion, we can show every woman that her life is important. By working together, we can inspire hope and become a force to get her access to the care she needs. Before moving on to the program, I would like to introduce the speakers. Today, we are privileged to have the First Lady of the Punjab, Mrs. Perveen Sarwar, with us. Mrs. Perveen Sarwar described herself in 3 simple words: family, charity, and politics. She is the driving force behind the Sarwar Foundation. Mrs. Perveen Sarwar was born in Pakistan and moved to Scotland at the age of 4. She has devoted her life to charitable projects and returned to Pakistan in 2013. She is passionate about women empowerment and established Hunar Gah. It's a skill training center to enable women to learn skills, go on to start successful businesses, and find suitable employment to support their families and make their lives better. She is the president of Girl Guides Association Punjab. In 2018, Mrs. Perveen Sarwar launched the Hepatitis Free Punjab campaign. She signed MOU with leading hospitals to work in collaboration to help eradicate hepatitis in the Punjab and the country. Mrs. Perveen Sarwar launched the Breast Cancer Awareness Campaign in October 2019. Visits to school, colleges, and universities to raise awareness were started across the Punjab with volunteer doctors to train the teaching staff and students on how to do a 5-minute self-examination that could help save their life. So thank you so very much, Mrs. Perveen Sarwar, for joining us today, and we welcome you from the bottom of our hearts. Next, we have Dr. Tasneem Amjad with us. Dr. Tasneem Amjad is a consultant at Surgimed Hospital with over 21 years of professional experience in gynecology and obstetrics with a special interest in infertility. She has been playing her role in breast cancer awareness campaigns as and when needed. So we welcome you, Dr. Tasneem Amjad, on the program.
Thank you very much.
Next we have Professor Dr. Mariam Malik. Professor Dr. Mariam Malik graduated from King Edward Medical College, Lahore. She is Fellow of the College of Physicians and Surgeons, Pakistan, and a Fellow of Royal College of Obstetricians and Gynecologists, London, UK. She has worked in government medical colleges and hospitals and retired as professor and HOD from Fatima Jinnah Medical University, Lahore. After a break of almost 2 years, she has joined Central Park Medical College and working there as professor and HOD. So we welcome Dr. Mariam Malik on the show. Last but not the least, we have Ms. Margo Abdul Aziz. Ms. Margo is currently the director of the International School of Choueifat, Lahore. Ms. Margo has been in Pakistan for the last 11 years. Before that, she worked in the field of management and education in the United States, the Middle East, and North Africa. She holds MA degrees in business administration and quality management. At present, she is enrolled in the executive MBA program at the Harvard University. So I welcome all the panelists, and without wasting any single minute, I would jump to the questions. My first question is toward Mrs. Perveen Sarwar. And the question is, it's about a myth that usually people think that if I don't have a family history of breast cancer, I won't get it. Is this correct? Over to you, Mrs. Sarwar.
I think it's not correct because everybody is different and every body is different. In my family, 3 women have suffered breast cancer and have survived breast cancer. My sister, my sisters and daughter-in-law, who's not blood related, and my sister-in-law. None of them have any connection. They're not blood related, but 3 of them were affected and they have survived. But what I would say to the sisters, we have to watch our diet. We have to watch and make sure that if there's any change in our body, that we go and see a doctor. I myself had 2 lumps, but they were benign, and I had them removed. So I was one of the lucky ones because I made sure as soon as I found out that there was something not right in my body, I sought the right kind of advice and went to the right place. And this is what we need to get our message across. We need to try to reach those rural areas to make sure that these women know how to do a 5 minute self-assessment.
Excellent, excellent. Dr. Mariam, would you like to add on to something what Mrs. Sarwar has said? Over to
Yes.
you.
Number one, that just about 5 to 10% of the ladies have that family history. So that means the vast majority, 90%, don't have that family history. And like Mrs. Sarwar pointed out, it just happens. And part of being a woman and part of growing old. So us being women and at a later age, because we go through life with all the wear and tear. So this is something that happens later. However, like she pointed out, that we need to have a great life that is true to nature, close to nature. So we need to eat healthy. We need to have some exercise. And most of all, we need to reach out to our other women who are not so privileged as we are. And we need to get to them, form a network, and see that is how we need to work together.
Excellent, excellent. Dr. Tasneem, would you like to add something?
I agree with Ma'am Sarwar and Professor Mariam. More than 75% cases, they do not have a family history. So what it means is that every woman has to be vigilant about it, that she is a potential case of breast cancer. And the early detection is the key to better survival rate. That's all I have to say.
Wonderful,
Thank
wonderful. So moving on to the next question. Again, my question is toward Mrs. Perveen Sarwar, and I'll request the rest of the panelists to add on. If you maintain a healthy weight, you exercise regularly and eat healthily, you don't have to worry about breast cancer. Is this correct? Would you like to add something, Mrs. Sarwar? Over to you.
I think having a healthy diet, exercising does help in many ways, but there are women who are overweight who have suffered cancer. It comes back to the family history a little bit or nature. As Dr. Mariam said, it's how we are with ourselves and how our body is. I've seen healthy women who've lived a healthy life and at the age of 45 or 50, they're diagnosed with cancer. So I think tests will show what causes cancer, but it comes back down to making sure that we eat healthy, we exercise, and we make sure we know our body and we keep testing ourselves and checking ourselves and seeking the right advice.
Wonderful, wonderful. Dr. Tasneem, would you like to build up on this? Over to you.
The important thing is that one should not give up on these healthy ways of life. I mean, the weight, the exercise, eating healthy is important because it keeps so many other problems away. But at the same time, like Ma'am Sarwar said, that we have to know our body, we have to keep vigilance, we have to go through self-examination regularly for early detection of this problem because everybody is at risk. There is no one exempt from having this problem.
Great. And Dr. Mariam, over to you.
Yes, I love her statement. Everybody is at risk. Yes, that is very, very true. All us women are at risk, and we have to reduce that risk by staying vigilant all the time. We cannot stop being vigilant. Thank you.
Wonderful. And there is another myth that I've seen on the internet that using underarm antiperspirants can cause breast cancer. Is this true, Doctor Mrs. Perveen Sarwar?
I think we forgot Miss Margo.
Yeah, he trained me. He trained me to raise my hand if I want to add something, and he just totally disregarded it.
I saw you.
No, I just a very, very brief statement, for the question number 2. I think, particularly with the younger generation, younger women, I think we have to somehow bring it to them that there is not a single bullet which will protect us from breast cancer. There is this kind of everywhere. I'll give you in a minute example of the United States, which just recently happened. That was on the news. There is not even what it may be used in the past, that a certain age, is more prone to, even without the history in the family, is prone more to get the breast cancer. This is actually not true. There are women who are in their 20s and dying. And just recently, she's very, I don't know if you will remember, you will know it. I remember it, from my parents and grandparents talking about Lucille Ball, very famous actress in the United States and in the world. And today there was a very sad news that her daughter, 31-year-old woman, died from the breast cancer.
Oh my God.
So you may have everything: exercise, nutrition, good life, money. Nothing helped. She passed away from this horrible disease, which was not in the family at all. So what it means is, the bottom line is, somehow, as early as possible, probably with the young women, I still call them women, young women, 15, 16 years old, in the school, we should have started to teach them how to check them. And then eventually in the 20s, I think, both Tasneem and Madame Sarwar and Dr. Mariam will agree with me. We used to say that the mammogram, we can take it when we are in the 40s, that's enough. Now the doctors are advising us, do it in your 20s.
Can I respond?
Yes, Dr. Mariam.
Yeah, and that is so true that mammography is very good. But when we're talking of Pakistan, and because we're talking of younger women, so there we also use ultrasound scan along with mammography, because they have dense breasts, and that is why we have to use all modalities. And also because ultrasound scan is easily available. So we cannot just talk about mammography, we have to give them choices. So if one is not available and it is expensive, so then you can go for ultrasound scan, which is more easily available. And the whole idea is to seek help, to help herself and to seek help. These are the two important messages we have to give out to each and everyone. Thank you.
Excellent. Okay, Mrs. Sarwar, would you like to add something?
Will I answer the next question?
Yes.
Here?
The next question.
Talking about antiperspirants, I think if you've just done waxing, it's not good to use it right after waxing because your pores are open. And also, I would suggest my sisters who are listening that if you're using an antiperspirant spray, to wrap a towel around yourself and use it underneath the towel so that you don't inhale it. But the problem that we had when I was in the UK, I used to campaign for cancer research in the UK. And what we were campaigning for was shorter waiting lists in the NHS so that sisters could get access and would get tested. And the other one was to tell the sisters that they're not to be frightened. Because there were a lot of sisters that they felt that they had that lump, they would not go to the doctor because they automatically thought that we are going to have cancer. And if you have a problem, it does not go away if you ignore it. You have to get it head on, and you have to make sure you seek the right advice. You cannot sweep it under the carpet and think this will not happen to me. I've seen many friends, young women, young mothers having, baby and then finding out that they got cancer. So it affects every woman and every age of life. And it does not just affect women, it affects men as well. We need to check away to make sure they check themselves as well.
Wonderful, wonderful. Dr. Tasneem, would you like to add something? You wanted to say something? Yes.
I have been able to listen to Ma'am Perveen. The voice was breaking, but regarding the antiperspirant, even though there is no scientific evidence yet that they cause cancer, but since we are exposed to so many synthetic products, that it is always wiser to find another solution, more organic stuff is available for this purpose. That is my personal opinion. Otherwise, scientifically, it has not been proven that they can cause cancer, even if the product, yes.
Okay, so I would like to mention it to the audience that the questions that are being discussed here are actually to, reinforce something, some viewpoints that would create awareness. So obviously the main purpose is to create positivity, right attitude and awareness. So moving on, the next question is toward Mrs. Parveen Sarwar. And the question states, could annual mammograms guarantee the breast cancer will be found early? Over to you, Mrs. Sarwar.
I think with the mammogram, I myself had one done when I was in the UK last month. And after 4 years, because my sister suffered breast cancer and I think they found it, the doctors advised I should have it. It still comes back too, because I had this done after 4 years. Still come back, making sure that you check yourself every month. Then the right advice, because sometimes people end up going to a mammogram because they hear that they should get it done, and then sometimes we are taking up the time of somebody who is suffering cancer, that appointment could go to that person. We have to make sure that we don't take up somebody else's time, that we make sure that we know what we are doing and what we feel in our body, and if we feel that there is something not right, then we seek the right advice. Otherwise, that time and that appointment could be given to somebody else.
Wonderful. Dr. Mariam, would you like to build up on this?
Yes, beautifully said. Because all over the world, there is some restriction on the resources that are available. And she's very rightly said so, that if we know our body, if we learn to protect and to listen to our body, so then possibly just breast examination. And if we feel something is wrong, then talking to your doctor, and then that doctor will decide, depending on your family history, depending on what is seen there, that doctor can decide whether you need to go for mammography and how often. That is, and of course, we cannot really rely on annual mammograms because there's a whole space of 364 days in between. And cancer is something that can be coming up in between that time period. And some of the cancers are very, very, they come on quickly and they spread quickly. So we, like I said before, we need to look after our body and we need to continue to be vigilant, and we need to make self-examination a part of our routine. And we need to figure out that whenever we see something that is not part of our body to begin with, we need to consult the doctor. Thank
you. Excellent. Dr. Tasneem, would you like to build up on this, please?
The mammography is a good way of detecting the cancers early, but it's not a foolproof system because there are 15 to 20% chances of false negative results. So we cannot totally rely on them. And besides, as Ma'am Perveen said rightly, that the resources are always limited, especially in countries like our Pakistan. So we should rely on more self-examination, and we should go to the clinicians, and if they decide that we should have an ultrasound or a mammogram, then we should go for it.
Okay.
Thank you.
So, Ms. Margo, would you like to add something, or shall we move forward? Ms. Margo, please unmute yourself.
Sam is mute. You are muting me.
Okay. So
it says that the host muted me. So, anyway,
okay, so
coming back to the discussion, definitely for any disease, just going once a year for a checkup, it could be misleading, because during the year a lot of things can happen. It can be a positive change, an improvement, and at the same time it could be a, however slow, but a decline. And this is what I would like to come back to start as early as possible, as a late teenage girls, when we with the school doctors have an access to them, maybe and making maybe helping them to learn of this 5 minutes, but also do more like doctors, professional check, at least twice a year, and maybe even 3 times a year. I understand that if we put more on the women who many women will be willing to do that, to go twice or 3 times for the checkup, against the breast cancer. But we also have to talk about finances. We have to talk about money. How the countries handle this. Is it covered by insurance? If it's not covered by insurance, we can get it at the very low rate. If it is a little bit higher rate, maybe the state it's out to our taxes to help the women, to encourage them. We can't expect the women to go, women and then their daughters. Remember, we as the mothers also teach and pass the right, proper behavior and taking care of our health to our daughters. That's financially sometimes might be quite a burden.
Perfect. So moving on to the next question. My next question is towards Mrs. Perveen Sarwar, and the question states that it's basically a myth. It states that breast cancer always causes a lump you can feel. Is this correct? Over to you, Mrs. Sarwar.
I think it's not always a lump, because if I look back at the history of my sister's daughter-in-law, she was just feeling pain. And when she went to the doctor, several times the doctor told her that she had muscular pain. And it wasn't until she demanded that she should be sent for a mammogram that they found out that she actually had breast cancer. So everybody's body is different. But what I would like to add, because I also do health camps, and I've been doing health camps for the last 4 years for mother and child. What we do is we take the ladies aside and we teach them how to do a 5-minute self-assessment. That is a part of our program. I've introduced that in my hospital so that when the ladies come, there is one woman who takes the ladies before they go in to see the doctor, and she has a pep talk with them, telling them that if they find anything different in their body, when they go inside to see the doctor, they must raise this. Because I think we need to reach out to those people, because in our country we have 2 problems. In our country we have one problem, that many people don't have access to TV. The second problem is many can't read and write. It's those people that we need to reach out to. Those people who cannot afford basic tests. It's those people that we need to reach out to. It's those people that we need to have the little seminars with. It's those people that we need to talk to. Because when we are in the universities, in the colleges, it's those people who can afford to come to college. It's those people who can afford to come to the universities. But it's the people living in the rural areas who don't have this access. So we need to extend our way of campaigning in our country to make sure we reach those pockets if we want to help to save lives. Because the majority of the women in our country that die are women in rural areas. It's women who cannot afford a basic test.
Excellent, excellent. I would like Dr. Tasneem to, Miss Margo would like to say something. Yes, Miss Margo.
Madam Perveen mentioned, I think, there also comes another aspect, which, over the years in conversations with the ladies here, with the friends, came up. And this is the issue of, particularly in the areas outside of the city, is the issue of how the family takes it, particularly brother, father, husband. This is not something, this is not considered as a disease, like, I don't know, flu or whatever it might be. It is a shameful thing. It diminishes the woman's value for the family and for particularly for the male members of the family. And I think together with the education of the disease itself, they somehow programs, maybe through the psychologists, through the very well-known people here, we could have something which could affect reaction and attitudes of the families, particularly in the smaller parts of the country, maybe with a less educated people. I think, to me, from what I'm hearing, I don't have the statistics, but what I'm hearing, this is quite a huge problem.
Very true. I would like Dr. Tasneem to please add on to this. Over to you, Dr. Tasneem.
Okay. Regarding that, the breast cancer always causes a lump. You can feel it's not really true, because there are cancers which do not cause lumps. So one has to be vigilant about any change in the breast, charge from the nipple. These are all other signs which can help you to reach any. True that there is always a lump. Sometimes there is no lump, and sometimes there is a lump and it is benign, as Ma'am Parveen initially said. So we have to be very, very careful, not just look for the lump. Any change in the breast, you must immediately go to the clinician or doctor.
Perfect, perfect. Dr. Mariam.
Yes, sir.
Would you like to build on this?
Yes, sir. It is a fact that if there is a normal discharge from the nipple, that is also significant. If there is change in the skin, whether there is redness or whether it becomes scaly, that also is a sign that you need to report it. The whole breast becomes inflamed, means that it gets swollen, it is red. So that again is one type of cancer which needs to be ruled out. And we are building on what Margo has just said, that yes, we've got a huge cultural problem, and whole lot of ladies will not tell that they have a problem. Maybe you call it, I don't know what you would, shyness or what, but they will not report it till it is a big lump or till it has started to ulcerate and there is pus coming out or discharge from there, and it is already then at an advanced stage. So any change, know yourself, any change, report it. Thank you.
I agree.
Dr. Tasneem would like to speak. Yes.
Yes, because there is this problem, there is a religious angle to it and a social angle as well. And this is a male-dominated society, especially in the rural areas. And I have actually seen patients in the cities where the father decides whether she should get treatment or not. Once there was a patient with an ovarian malignancy, and the father said, no, she's getting married in 3 months' time. I cannot afford to have a surgery done right now. So there are problems, very serious issues here. Ma'am Parveen, I would like that she should take notice of it. And as she said, that there are where we have to reach and to break this myth that it is the body.
Okay, perfect, perfect.
It's not that the male has to decide that which is wrong. Thank you. Thank you.
Thank you. Thank you, Dr. Tasneem. So moving on to the next question. My next question is towards Mrs. Perveen Sarwar, and then we will move on to the rest of the panelists. That does early stage breast cancer rarely recurs? So, Mrs. Sarwar.
Yes, I've seen many patients who've had cancer, they've survived cancer, and then it's come maybe 4 years later or 5 years later. So this is why sisters who have suffered cancer, we want to tell them that they are not alone. We are campaigning for them, with them. And they should go back and keep an eye on their weight and their diet and whatever they're feeling. And just now when we were talking to the panels, during COVID-19, with the Chamber of Commerce and Sarwar Foundation, which is my organization, we opened a telemedicine for women only by women doctors. And it was for women who could phone and speak to a lady doctor, because sometimes they cannot speak to a male doctor and they don't feel comfortable. So the first day we started the telemedicine, we got 360 calls in the one day. Talking now with this conversation, what I have decided to do is when in that telemedicine center, I will make sure that we put flexes behind the doctor so that when a sister is calling, she sees the breast cancer banner at the back. And maybe that will encourage her to speak up. And I will also make sure that I put banners in both of my hospitals, that when women come, they see these banners, and that maybe that will make them realize that they need to speak up and find out more about it. I will make sure that they're done in Urdu, I will make sure they're done in English, and I will try to make something that somebody that can't read and write can follow the pictures and see what the message we are trying to get across. So I will make sure I will implement that.
Beautiful, beautiful. Miss Margo would like to add something. Miss Margo, over to you.
No, I would like to ask Mrs. Sarwar if this is really something which I think it would be helpful, but again, maybe it will not be neither culturally or technically, possible. In other countries, for different diseases or different mental problems, there are hotlines. When the women or men can call, you just mention and talk to the specialist, basically. You just mentioned that, some of the women may be less educated, they will not speak English, they will speak Urdu or Punjabi or one of the dialects if they are from another province. Wouldn't be hotline another because there is no one way to help this woman. Maybe having different ways of doing it, and maybe hotline could be one of them to consider. That and you are very anonymous. You don't need to tell your name. Nobody sees your face. Something which maybe encourage older and younger women to grab this phone and say, okay, let me talk to someone. Let me get advice what I'm supposed to do.
We will add it to the telemedicine center, and we will make sure that we put banners up, and we will put on it that if you want to speak to somebody regarding this, then we'll have somebody assigned to deal with that case, somebody who's experienced in cancer. So this is my next step. I will have a meeting, and I will make sure we add this on. I will.
Excellent, excellent. Thank you. So, Dr. Mariam, would you like to answer this question? That does early stage breast cancer rarely recurs? Over to you.
It does recur, but before that, for the people who are listening to us, let me make it clear that yes, self-examination of the breast that we are talking about, and that is something that we want to make a gold standard, knowing your body and doing it every month and doing it regularly and doing it vigilantly and not stopping doing it. So I did read a few messages that said that self-examination is the way out. Yes, of course, it is the way out. And everybody needs to know about it, and everybody needs to learn it, and everybody needs to practice it. Does early breast cancer rarely recur? Well, I mean, if it is diagnosed early, so then yes, it has got a good prognosis, and breast cancer survivors are there who have survived it for 20 years and even more. But throughout life, we have to stay vigilant. It can recur, and there is no way that you can think that early stage cancer does not come back. Most of these cancers, they recur in the first 2 to 5 years, but there are others who have recurred even like 20 years later. So you have to stay vigilant throughout your life. Thank you.
Perfect. Wonderful. Dr. Tasneem Amjad, would you like to add something?
Yes, I agree with what Mariam is saying, but the chances are very, very less with the early stages. It is less than 1% in 5 to 20 years, but still the chances are there. So they need follow-up visits, initially monthly basis and then annual basis. And after 5 years, you can increase the interval of the visit. So it's important not to forget about it, that the early stage cancer can recur.
Okay, wonderful.
Thank you.
Wonderful. So moving on, my next question is towards Mrs. Sarwar, and the question states that all breast cancer is treated pretty much the same way. Is this correct, or there are different ways of dealing with this? Over to you, Mrs. Sarwar.
I think there are different ways. There are sometimes when they need to have the whole breast removed. Some of them just need laser treatment or other kind of treatment. So every patient is different and every treatment is different. But what I would like to also say to the sisters, that if they are suffering cancer and they have survived cancer, it's always to keep a healthy mind, always best to stay positive, because there are many survivors who have survived 25 years, 30 years, 40 years, and go on to live a healthy life. We cannot put things on hold and think it's going to come back. Keep a healthy diet and think positive, and you're halfway there, I think.
Beautiful, beautiful. Dr. Tasneem, we need your views on this as well.
Well, the general outline for the treatment, we can say is the same, that there is surgery, whether conservative or radical surgery, then radiotherapy, and then chemotherapy, hormone therapy. But the treatment is individualized according to the needs of a particular patient, and though it depends on the stage, the grade, the hormone sensitivity, and the age of the patient and the physical health of the patient. So it has to be tailored according to the patient, and it is a multidisciplinary approach. You need a psychologist as well there, oncologist and a surgeon, and all the other facilities should be there. So it has to be tailored according to the patient. So it is different for according to that.
Dr. Mariam, over to you.
Yes. I mean, I am just agreeing with the two panelists that there is, we treat cancer with chemotherapy, we treat it with surgery, we treat it with radiotherapy, and we treat it with a combination of all three modalities. And when you report to the oncologist, to the special doctor, so then a plan is made out. And there is 3 or 4 doctors sit together and they make a plan for you as to how they are going to take you forward. Certain tests are also carried out, and that determines whether your cancer has estrogen receptors or progesterone receptors. And they also would like to do, like she's pointed out, it also depends how fit your patient is, and whether the disease is caught early, the type of the disease, whether it is going to spread quickly, and that is how it is catered to your needs. So with everything, it is different.
Excellent. I think this is giving a great insight to the audience. I mean, whoever is listening, I think he or she should share it with their social circles so that this awareness could save a life. So, Ms. Margo, would you like to add on to something?
Not to this point. I actually would like to ask the question. The question you can hear, in a number of discussions in the different countries particularly Europe and the United States. But I'm sure it comes up here in Pakistan as well. I don't see the reason why not. The question is, and many women are asking it, is the environment, declining environment in which we live, has any impact on the growth? Because I have the statistics, I will later on share it with you, on the incredible over the world, incredible rate in breast cancer in women.
So, who would like to answer this? Panelists.
Say that, certain things take effect. For example, when you're drinking contaminated water and then you end up with hepatitis, if it's not treated in time, it can lead to cancer. So there are a number of issues in different countries, and especially in Pakistan, because I'm working in clean water, I find that in rural areas, people come to us and say to us, they've got liver cancer, this person is on dialysis. Yes, there are a lot of things that contribute towards cancer, but I am not a doctor. Only a doctor can answer the question properly. But I have found in my hospital, when people come to us because they've been suffering due to contaminated water, hepatitis, it has led to cancer. But as I say, only a doctor can shed more light on it.
Wonderful. So, Dr. Tasneem would like to add something. Dr. Tasneem.
Well, I would say in a general way, the way we have treated this planet, the way we have used technology to make everything into a standing reserve for us and to get the maximum out of everything, it has actually affected the climate in a very, very massive way. And we are reaping the results already in the form of different viral infections, different diseases, and cancer is on the rise. Like the young generation, I have heard them saying that in the old times, the people would die of tuberculosis. Now they die of cancer, which just reflects how much prevalent cancer has become, not just breast cancer, all sorts of cancer. And I see patients being operated for brain tumors, very young people in my hospital almost every day. So there is this problem. I agree with Margo that there is this problem that we have been treating the planet in a bad way. We have been just using it and overusing it. We have not been taking care of this earth, this planet, to sort of improve the environment. And still there is time, and I think the PTI government is doing a great deal by planting the trees and trying to take this issue seriously. So let's hope something good comes out of it.
Perfect. So, Dr. Mariam, would you like to add something onto this?
Well, the climate and of course, like you pointed out, the way we have changed our lives has had an effect, and possibly Margo would have greater details on the effect of the climate. But like our eating habits, we use pesticides when we grow our food. Those pesticides are also going to have a negative effect. When we bring up our chicken, we are feeding them hormones. When we are feeding hormones to or injecting hormones to the cows and buffaloes in order to get more milk, all that is going to have a negative effect. And the pollution, possibly as we bring more pollution and how it is affecting our skin, the way we are treating our skin, that again is going to have a negative effect. But this is something that is, and the way we stay awake all night and the way we are exposed to ultraviolet light and we just don't stay awake. We are actively involved in looking at the computers and looking at our telephones, and that also is is having a negative effect on our entire system. And if the entire system is undergoing a change and is not at rest, then all these things are going to affect and increase the cancer rate. And breast cancer is just one of the cancers that
Very, very well explained.
Thank you.
Very well explained. So moving on, my next question is towards Mrs. Parveen Sarwar. Breast cancer only happens to middle-aged and older women. Could this happen to men also? What to do and where to go? Over to you, Mrs. Sarwar.
It does not affect older women only. My daughter's friends, my daughter-in-law's friends have passed away due to cancer at the age of 28, at the age of 32. Somebody has passed away at the age of 21. So age has nothing to do with this disease, unfortunately. And it is rising, as the sisters have just pointed out. It affects men and women. And yes, we need to watch what we're eating. And yes, we need to make sure that our planet is safe. And I just learned something the other day that each person needs 3 trees. They use the amount of oxygen that comes from 3 trees. So if each one of us plants 3 trees, that can help the environment. So this is something that we can learn. And my school, I had this lecture, and this is what I learned from my own school. So this, we are going to plant 1,000 trees in our school. Every child knows that this is the second plantation we're taking place. So I would encourage everybody to plant a tree, whether it's a fruit tree, because in our country there is so much poverty. And if we plant a fruit tree, somebody can eat the fruit from that tree. But coming back to the topic today, I think a lot has to do with the way their living standards are, and the areas that they live in, and the food that they eat. There are still a lot of people who don't have a fridge, and sometimes the food is left outside. It has bacteria, and that food is consumed. So there are lots of things that we need to look at, and there are lots of things that I think when we're out giving lectures and talks that we should add all these different points to raise this kind of awareness. So, I think today we've learned a lot. I've learned a lot from the sisters, and there is always room for improvement, and there is always room to learn.
Excellent. Dr. Tasneem, would you like to build up on this?
I think even though the breast cancer is more common in middle-aged and older women, but the chances of developing breast cancer in women younger than 40 years is less than 4%. So it is still there. It does not mean that they are exempt. And in case of men, the men can also have breast cancer because they have breast tissue, and the incidence is very low. For instance, it is 1 in 1,000 in men. And if they have a problem, they should always go to the doctor for further investigation and treatment.
Excellent. Dr. Mariam.
Yeah. Yes, of course. I mean, in the vast majority, 80%, it is a problem of the older women. But the thing is that, like everybody's pointed out, that it is there in younger women. And it is the younger women who need to bring about the change, because it is the younger women who will start examining themselves and spread the message. And it is the younger women who are going to lead the way. So that way, they are the heroes of the day, and they need to lead and take control of their lives and their bodies and their health. And they are the ones who are going to bring about the change. Yes, where to go? Go to the doctor, go to each other, network with each other, and talk to somebody. Just don't keep it to yourself.
Excellent. Ms. Margo, would you like to add something?
I have a couple. I think one thing which is, I think it's maybe naive or unrealistic, or maybe too sensitive in a country like Pakistan to do it. But we are the women who dream big. We are the women who take risks. We are the women who put a lot of effort into step by step, drop by drop, bring changes to move the country into the newest stream, when it comes in the social life. So my dream is that one day, and hopefully one day soon, When we have classes of biology in the high school, so we're talking about children or young children, young adults, grade 9 to grade 12, they are there, 17, 18, 19. In biology classes, when we talk about, and they see, all those animations of lungs, of heart, of kidneys, why? Why would it be wrong? Why would it not be one of the preventions to show and talk about the breast cancer in the classroom with the appropriate respect and, of course, preparing the children for that, young children for that? Because you know how young children react. Sometimes, trying to make a joke of it, etc. But it could be just at the very beginning. I think later on, they will take it very seriously and they will practice. And the earlier they practice, like the esteemed panel just mentioned, the chances of beating the cancer actually, or being in reverse, can go for many, many years. But not when we start, when we are 50 or 60 or even longer. So that's my dream, which I would like to share it with you. And I really, really hope that it maybe one day it will become reality. I think it will be a good thing.
Inshallah.
It's a beautiful dream. It's a beautiful dream, Margo, and I hope it comes true, because it is a taboo to talk about the genital organs, about breasts, about feet, child, everything. That's the real issue here.
Wonderful.
And 60% of the population is in rural areas. There, I have come from the rural area, and I know what havoc this is creating over there.
But we have to be, what we're doing, what we might be doing, and doing already with those very sensitive diseases, particularly in the society. We have to be courageous. We have to find out together with the religious establishment, how to do it. They could be very helpful. And I'm talking from experience of Egypt, when we started, HIV and AIDS. It was a huge taboo. But for a number of years working with the medical profession, with the psychologists, and with the religious establishment, very high religious establishment.
Absolutely.
Today,
I agree.
Today, people when they get sick, they get a proper medication, they accept it by the society, and they can have a normal life and to a certain degree recover. So maybe in the future, maybe it's worth trying, but of course, you will know better than I do.
Wonderful. And let's hope this dream comes true. Dr. Mariam,
yes. Yeah, in this age of connectivity and with all the young people listening to us, possibly they can start their own blogs. And
yes, Dr. Mariam.
Followings, and like we as a college, we have adopted the surrounding villages, and we are going there and spreading the messages. And like our first lady has said, that she is, through her organization, she's reaching out to such a lot of people. So I think that Mrs. Margo, your dream is going to be coming true soon, earlier than anticipated. Inshallah.
Inshallah.
Dr. Tasneem, we can't hear you. Could you please speak again?
I said I like Professor Mariam's optimism.
Wonderful. So moving on, because we have to keep an eye on the timings as well. My next question is very interesting, and I would request you to give a detailed answer to that. Mrs. Perveen Sarwar, when the treatment is over, you're finished with breast cancer, could you please put some light on the after effects, whether it is physically, psychologically or emotionally? Over to you, Mrs. Sarwar.
Thank you. Can I just add one thing before I answer that? I think, if we encourage young mothers to do breastfeeding, it is known that it helps to reduce cancer in women. And I think there are many new mothers who want to take the feeding, but put their child onto a feeder. And I think breastfeeding should be more encouraged in hospitals and schools and other things. Coming back to the question that you've asked, I know that when somebody suffers cancer in a family, it tests families. Sometimes families are afraid to talk to the person who is actually suffering, thinking that they will mind. This is a time when people need to unite, when family needs to unite together, make sure that they're there for one another, and only to make that person feel that they will talk to them when they need it, not to make that person feel that this is the end of the world, to keep that person positive, to tell them that they are going to survive. And that is the first step to keeping that person positive and making that person know that they've got a family who loves them, a family who is going to support them in every single way and every day of their lives until that treatment is over. And once that treatment is done, to continue that support, because that is very important to the family.
Excellent. Excellent. Dr. Tasneem.
Yes, well, when the treatment is over, you're not finished with breast cancer because there are chances of recurrence. Should you need a regular follow-up that your oncologist or your doctor is going to tell you. Initially, it is in months, couple of months, and then annual follow-ups, and then so on. And regarding the effects, the after effects, the physical after effects include there is change in weight, hair loss, fatigue, weakness, and other problems. Psychologically, you feel depressed, anxious, frustrated, and you are emotionally drained. And it is like Ma'am Parveen said, that it is not just you, the whole family is affected, your caregivers are affected. So it is a lot of drain on the whole family and the patient as well. So they need emotional support, they need physical support. So it's a difficult time. Thank you.
Definitely. Dr. Mariam, would you like to build on this?
Yes, please. When we are talking of physicality, so then, just because the cancer has disappeared, this lady is still on hormone therapy. And she is still suffering like effects of menopause. That is what we see. And a lot of them will come to you and they will beg for some kind of estrogen therapy. And you can't give it to them. And then, because again, breast is an external manifestation of beauty also. So they would like to have some reconstructive surgery. That surgery is also going to affect them physically. They have to go through operations, So these, and then of course, because the nerves also get affected. So then all these tingling, all that problem will also be there. When we talk of psychological, yes, it has been pointed out that the whole family suffers. And the lady then goes through the bereavement process. She misses her breasts. So she will say, why me? And she will say again, why me? And possibly she will become antisocial. And gradually, it has been pointed out that maybe it is not just the family. Maybe she will need like a proper help, maybe help of a psychologist, maybe help of a group that has gone through the same experience. And then she will be able to relate to all that and maybe able to share her emotions, because the whole family has suffered for a while. Then they also want her to move on, and the family would like to move on. And if they see no problem physically, then they feel that, okay, she has been in that space for X number of years. So now every person is different. So every person will need shorter time. Others will need longer time for healing, and that is there, and the help should be there, whether it is there or not. It should be there, and constant effort needs to be done by the healthcare providers also, and it needs to be pointed out that she needs to still complete that journey. Thank you.
Wonderful. Miss Margo, any
Well,
inputs from your side?
I think my input here will be a very, very personal. I lost my mother to cancer. And at the age, my mom was 37 years old. Suddenly, with no previous, underlying problems with health, taking care of yourself, no smoker, no drinker, perfectly healthy person. And obviously, I was very young, and I physically and even psychologically, I move forward. I move forward with my life. But I have to tell you that emotionally, it still stays with me. I have my moments when I recall the memories on holidays like maybe Christmas or Easter, when I terribly miss her. And her presence and her bringing our family together. So I think, for many of us, maybe not for all, and I'm sure not for all, the emotional road into our own adulthood, having our own families, it may take a long time and maybe never ends for some of us. But it is also very helpful, because then it mobilizes us to come together with women like yourselves, like Tasneem, like Mariam, like Madame Sarwar, that we want to do for whatever each one of us went through. We want to make sure that the other families and other women then don't go through. We can save many of women. Many of them. Doesn't matter where they are. Doesn't matter how difficult it is sometimes to reach them in Pakistan. But eventually we will.
Beautiful, beautiful. So moving towards the last question of the program, I would like Mrs. Server to please put a light on what efforts are being made to improve the situation and having more testing around the country at a lower cost. Over to you, Mrs. Server.
I'm not sure what efforts are being made, and because we've got Shaukat Khan and there's other various hospitals that offer mammogram and cancer, but there are efforts being made in the campaign, but we still need to reach those pockets. And as Margo said, us women, we've lost loved ones. My sister had breast cancer, but she didn't die of breast cancer. She was a survivor. But it wasn't until my sister was diagnosed with cancer that I actually started campaigning for cancer research. So I think when we are touched by cancer, we see a different light and we see women in a different way. And that's when we join the campaign. So I would welcome all those women and all those men who want to join us in this campaign to reach out to those people in any way we can, even if it's teaching the woman in your household, even teaching your maid, because I started this last year with the Girl Guides. When I went to the colleges, Dr. Mariam volunteered very kindly to arrive there before me, to get the girls to stand in a line and to teach them how to do a 5-minute self-assessment. We trained 750 girls last year to do a self-assessment, and we asked them to go on to teach others. And I think if the procedure we take on, and we have a direction that we want to do this, and the more women get involved, even the women that are listening today at home, they can teach their mothers, they can teach their friends. I think we can reach out to those people in the rural areas and help those people to go and seek the right kind of advice.
Beautiful, beautiful. Dr. Mariam.
In my introduction also, I pointed out, like last year, icons like our First Lady, she pushed us forward, and we were there with her going to the various colleges, and it was so passionate. Her passion was too much. And we also got caught up in that. And then we were able to transfer that passion to other colleagues of ours. So much so that me being a gynecologist, there were some surgeons who said, "Jiska kaam usi ko bhai." Na, I stopped and I said, listen, सिर्फ आपका काम नहीं है, ये हम सबका काम है. Because जो young girls हैं, जो ladies हैं, they would like to talk to ladies first. And we are not doing breast surgeries. We are just helping your work, and we are just spreading awareness and possibly doing the first examination and referring them to you. I just wanted to say that like now people who are going for prophylactic bilateral mastectomy, like that famous Hollywood lady, what's her name? Yeah. So, I mean, they are also icons. And icons, when the first lady says that my sister suffered from it, so that leaves an impact. When Margo says that my mother had it, it leaves an impact. It is something so personal and something so close to heart that others are definitely going to get a better message. And yes, we can bring about the change. And that is why I've always been positive. Positive. Being a teacher, you have to stay positive. Being a mother, you have to stay positive. Being a wife, you have to stay positive. And being a member of this nation, you cannot survive unless you stay positive. Thank you.
Wonderful. Dr. Tasneem, over to you.
Okay, I can only say this to Ma'am Parveen, that I offer my services wherever she feels deemed fit. I am available whenever she wants.
Wonderful, wonderful. Miss Margo. Miss Margo.
Well, I think, you know, that I would like to make it into very short parts. First of all, just bring us all together that we all know that prevention, education are the keys. Then, of course, you know, the checking, you know, if anything happens, you know, that's the stage number 2. The second thing is that we definitely need to be united. While each one of us can do a marvelous job, that is part of the selfishness only. I personally would like to see the groups of the women, the movement of the women. Okay, even here in Punjab, let's start small, you know, with Madame Perveen, with her foundation, you know, she will take breast cancer and us under her wings, you know. Let's do it on the bigger scale. Definitely. Yes, the cities are important. Schools are important. I have to do better for my girls and my boys as well. But there is no reason why we should not have a medical camp once a month, once a 6 weeks for women and men, and going, you know, to those further places and get them checked out and help them, you know, in a meaningful way. So the last thing, which I think brings us to what I just said a few minutes ago, and this is from the newest 2020 global statistics on the breast cancer. And it says that in the group age among women 50 to 64 years old, which at the moment in 2020, the increase is about 23%. By the year 2025, it will be 60.7%. That is 3 times more. And in the age group of 30 to 34 years old, which currently stays at 70.7%, the increase by the year 2025 will be 130.6%. I think the numbers show us the road.
True.
It is not disappearing. It is not increasing. Maybe in some communities, maybe in some countries. That's the breast cancer statistics globally by the 12th European Breast Cancer Conference, which happened in 2020. Those numbers, I think, are motivators, not negative, not taking us, oh my goodness, what we're going to do with it. You know, it's growing, we are helpless. No, this is a motivator for each and every one of us to get together and make sure that those predictions will never come true. They don't need to. It all depends on us. And of course, I would love to thank you, Mrs. Sarwar.
The health camps. I have health camps in Lahore every Sunday, and I have a health camp in Jhelum every Sunday. And you are more than welcome to join the 30 doctors that volunteer. And out of those doctors, we have a doctor that takes the ladies and the men aside and talks to them regarding breast cancer. And also coming back to the statistics, because of during COVID-19, I was in the UK, and a lot of the breast cancer patients were put on the back burner. They weren't allowed to go to the hospital because of the fear of COVID. That's how many people died. Many people could not get that treatment. And I hope as soon as we get out of this COVID, we need to move into that direction and make sure we reach out to those people that are suffering because of cancer and open our doors to them and start that program as early as possible.
Wonderful, wonderful,
and
wonderful.
If Madame Sarwar, if you think it will be appropriate, and I could come and join the camp here in Lahore, please let me know. I don't speak Urdu, but you know, just being with the people can feel support. You know, the language may not be that very much important, but if you feel that my presence would be welcome and would be useful.
You're welcome to come, Margo, and tell us how to improve our camps and get them even better. Your value would be much appreciated.
Thank you, thank you very much, and thank you this wonderful panel, wonderful women. You know, brilliant, absolutely brilliant. And Mrs. Sarwar, your presence, your adding, your experience, your vision, together with your position also as our First Lady, you know, gives us. You have no idea how much energy and passion to move forward. Thank you very much.
Thank you so very much. So with this, I would give you all an opportunity to give a message to the audience that has to be one sentence, and that has to be the takeaway of this session. So I'll start with Mrs. Perveen Sarwar, and we'll do it 10 by 10. So Mrs. Perveen Sarwar.
Take that 5 minutes to do a self-assessment. That could save your life.
Wonderful, wonderful. Dr. Tasneem.
Hello, can you hear me?
Yep, we can hear you.
Okay, we can trust yourself. By self-examination, you can defeat it.
Wonderful, wonderful. Dr. Mariam.
My message is that with this self-examination, one thing is there, and number two is that please don't hesitate to contact others. Thank you.
Excellent. Miss Margo.
Don't let fear stop you from doing the right thing. Prevention, education, reaching out to others, you're gonna be fine.
Beautiful, beautiful, wonderful. So with that, I would like to conclude this program. And I would like to thank the panelists from the core of my heart. That thank you so very much, panelists, for taking time out and being with us over this beautiful topic, wonderful discussion, thought-provoking discussion, and I'm very sure that the audience would have got benefit out of it. So thank you so very much once again. Please, audience, if you have any questions, please write in the comment box, and the panel to stay just for a few minutes. I'm ending the broadcast here, and we will come next week with another program, another panel. Till that time, please take care of yourself, take care of your loved ones, and Allah Hafiz.
Allah Hafiz.
Thank you.